So, Mr. Cooper.
Yeah.
Dr. McDonald, nice to meet you. How do you do? Before we start, can I just make sure the information I've been given about you is correct?
Yeah.
You're 33 years old, is that right?
Yeah.
And you're a plumber.
Yeah.
And it says here you've been having episodes of difficulty in breathing.
Oh, yeah.
Can you tell me a bit more around that?
Well, it's been happening for, I don't know, like 6 months or something.
Right.
Where I just suddenly get really short breath, like totally out of breath. And I can just, like my heart is just like going 10 to the dozen.
Right.
You know, it's to the extent it's really frightening. And I have to just sit down, you know, and just, you know, get myself together again. I just feel like I'm going to die or something, do you know what I mean?
Okay. And how often does this happen? Is it?
Well, it's happening quite frequently.
Right. So would you say it happens 3 times a week, 4 times a week, every day?
Probably something like 3 times a week.
Okay. And you say it started 6 months ago, so were you well up until that point and had nothing like that before?
Yeah, nothing. I mean, it just, when it first happened, it's just like totally terrifying, you know? You just, you don't know what's happening, you know?
Okay.
I still don't know what's happening, but the first time it's just really frightening.
So the main features are your breathing becomes difficult,
Yeah.
and then you have a pounding in the chest.
Like really, it's like going 10 to the dozen.
And you need to sit down, and then does it go away, or what happens
Yeah,
next?
eventually it sort of goes away once I sort of sit down.
Okay, and how long does it last for normally in a typical episode?
A good, you know, good few minutes.
Right, okay. So describe to me the last time this came on. What were you doing at the time?
I was, because I'm a plumber and a heating engineer, I was fitting a new boiler in a kind of a little cupboard.
Yeah.
Yeah, it's kind of pretty dark in there, and it's a bit, with my sort of game, you often find yourself in small spaces. And
yeah. And what symptom came on first, do you think? Was it the difficulty catching your breath, or the pounding in the chest, or...?
It's hard to say, but probably, yeah, more kind of, well, it's probably more my initially, I feel my heart going.
Right.
And then
Okay, do you have any warning that this is about to come on, or any strange sensation that it's about to start?
no, it just starts.
And have you ever felt, I mean, have you ever felt lightheaded as though you're about to collapse, as though you're about to faint?
I haven't fainted.
Right.
But, yeah, I mean, I feel a bit, you know, I feel woozy.
Yeah.
Hence why I'm sitting down, you know, but I'm not like totally killed over or anything.
Okay.
Well,
And do you have any pain in your chest associated with this
No.
pounding sensation?
no, it's just really going for it, the heart, you know.
Okay. And the breathing, is your breathing faster than usual, do you think?
Yeah, like much faster.
Right. And then it all just suddenly stops? Or...
I sit down and eventually it sort of goes.
Okay, so it gradually gets better.
Yeah.
So your heart gradually slows down rather than just suddenly slows down
Yeah.
afterwards. Right, I see. And have you ever noticed your heart beating in an irregular rhythm, or does it just sort of pound away regularly?
Yeah, no, I think it's kind of regular, I think. It's hard to say, but, you know, it's more that it's just really going fast, you know.
Sure. And you say at the time, I mean, do you feel very anxious when it comes on? I mean, it seems like it invokes. And,
yeah, like, totally.
And do you have a sense of impending doom when you have it, of something terrible about to happen? Or
Well, I don't know about that, but I feel, you know, I feel anxious.
Yeah. And in between episodes, do you feel anxious, or is it just when the episode actually comes on?
I mean, generally, I'm, you know, I find, you know, I probably am a little bit more than I have been in the past, feeling, you know, I've got a lot going on in my life and stuff.
Right.
So, yeah, I'm feeling a bit anxious anyway.
Okay, well, we'll come back to that in a moment. So between these episodes of difficulty breathing, what's your breathing like normally? Are you able to walk up flights of stairs,
Yeah, I mean,
run for a bus without getting out of...
I'm like, consider myself, you know, like relatively fit.
Right, okay. And do you ever have any pounding sensations in your chest or palpitations in between these episodes?
No, that's what I mean, they just start.
Okay. And is there anything consistent about when they come on, do you think? Is there anything you've noticed that might trigger them? Or any activity you're doing at the time, or...
Well, no, like I said, like I was in the cupboard when it started. because I'm, like I say, I'm often working in little spaces. It might be, now I'm thinking about it, it might be when I'm in little spaces.
Yeah.
Do you know what I mean? When it's dark and cramped, and you do get a bit. I'm usually pretty good at stuff like that, but you get a bit. So if anything, I'd say it could be something like that.
So if you feel a bit boxed in, you're already feeling a bit more anxious, and that might precipitate one of these.
Yeah, and that happens a lot in my game, you know.
Okay. Tell me a bit more about your work. So you work as a plumber.
Yeah.
Is that right?
But I haven't been doing that very long.
And what did you do before?
I was in the fire brigade.
Right. So again, somewhere else where you might have been in cramped or dark circumstances.
Yeah.
Right. But it's only really been a problem for the last 6 months in this job?
5-6 months.
Okay. Do you have any other symptoms, any other problems that you've noticed?
Well, like physically?
Any headaches, for example, or funny dizzy spells that are separate from this episode?
No.
Any problems with your waterworks or your bowels?
No.
And in terms of your breathing, do you ever have a cough or cough anything up or have any pain?
No.
You mentioned you have no pain in your chest, but no pain associated with breathing deeply, for example?
No.
Okay. And tell me, when you get these episodes and you're breathing quite fast, have you noticed any tingling sensations anywhere in your hands or elsewhere?
Yeah, actually. Like weirdly, kind of like on my lips a bit.
Right.
And like on my fingers.
Right.
I can feel it tingling.
And does that just gradually go away?
That just goes, yeah.
Right. Do you have any other medical illnesses at all? Any other conditions you've been treated for? Have you ever taken any medications for anything in the past, for
nothing
example?
kind of... I had a couple of years ago, I was involved in a incident when I was with the fire brigade, and I was off for a bit with, basically it was like smoke inhalation.
Right. Okay.
But that lasted a couple of weeks, you know.
Right. Did that lead to any problems with your breathing in the long term?
Not in the long term. In the short term, I was sort of short of breath.
And did you have any? Sorry to interrupt. Do you have any tests or investigations of your lungs at the time, or?
Yeah, they did. Like just the fire brigade. They have to deal with that sort of stuff.
But you've since not had any follow up with a respiratory doctor or
no.
anything else?
But it was all sort of cleared at the time, you know.
Right. Okay. And I mean, you mentioned you never blacked out on this with these episodes. Have you ever blacked out before in the past, or collapsed, or fainted, or anything like that in the course of your work? Or
yeah, not work. I did once a couple of years ago when I was playing squash with my brother-in-law, and I fainted actually.
Right.
But then they said, because they took me to the hospital, they just said it was because I hadn't been drinking enough water.
Right, you said you were dehydrated, and did they do any tests there on an X-ray, a heart monitor test, for example, or do you remember much about it? Okay, right. But so you had no further follow-up or investigations?
I just overdid it, basically.
Right, I see. You mentioned being in the fire brigade before. I mean, why did you leave the fire brigade? Was there any particular reason why you changed to plumbing?
The technical word is like, they call it stress-related illness, basically.
Right.
I've been in there a long time, and then the incident where I had the smoke inhalation was like fairly traumatic.
Right.
And I just couldn't do it anymore.
So there was you did have a lot of stress and anxiety before these last 6 months as well, really. Okay.
Yeah, hence why I left the brigade. I was invalidated out basically because I couldn't take it anymore. And
do you mind me asking what the event was that was very stressful or traumatic?
No, it was just there was a fire in Tooting in the underground station, and it was just it was difficult.
Right.
I mean, obviously, over like 10 years I was with them, I've seen stuff, and but that was difficult.
Is that something you have flashbacks about that can come on at any time when you're at work or when you're in a dark, cramped space, for example?
Yeah, maybe. I don't know if I call them flashbacks, but obviously I think about it.
Right. You don't suddenly have a very sort of vivid imagery in your mind about what's happened to you, or nightmares about it, for example?
I don't know if I go that far.
Right.
Because I know it's like having it proper, isn't it? You know what I mean?
Yeah.
Like, but yeah, obviously it's still very much on my mind.
Have you had any counselling for this, or any treatment for depression or anxiety from your GP or someone in the doctor?
Yeah, I did. When I first left, I went to my GP.
Right.
And I was on some antidepressant for a few months.
Okay.
And then I just didn't, I just stopped taking it.
Right. I see. So since moving jobs, I mean, you mentioned a lot was going on in your life as well. Are there other things or problems at work or other causes of anxiety?
What, within my life?
Mm.
Well, the regular stuff,
Right.
Money.
Right.
But,
And when did you last take antidepressants?
When did I last take them? I don't know, 4 months ago.
Right, okay. So you've not been on them for the last 4 months or so. And was that your decision to stop them, or your GP's?
Pretty much my decision. I just thought, they got me over the initial kind of feelings I was feeling, I think.
Right, okay. So you felt better, or less anxious? Or
yeah, and I'm not crazy about taking that sort of stuff anyway,
sure.
But yeah, I think they did. I didn't think being on them any longer might have helped me, I don't know.
And are there any other things you use to control your anxiety? Do you smoke, for example, to relax, or
No.
do you drink much alcohol at all?
Yeah. Yeah, well, I don't know if it's much, but on an evening I have a few tinners, just to, like watching the telly sort of thing.
Right. How many cans of, is this lager or?
Yeah, lager.
Right.
Okay. Probably, if I'm honest, like 3 cans of Stella or something.
Right. Per night, usually.
Yeah.
And do you ever have sort of 3 or 4 days without any alcohol at all in the week, or do you think you'll drink pretty much every day?
At the moment, probably, if I'm honest, yeah, every day.
Right. Do you have any family history of similar problems? Anyone else in the family have heart difficulties, or your mother or father, for example, had palpitations? Or
I don't know. My dad died when I was a nipper.
Right.
And
how old was your dad when he died?
Well, I don't know what he died of, but he was 30 something.
Right.
So he was pretty young,
Yeah.
I don't know what he died of.
And is your mother well?
Yeah.
Okay. So if I can just summarise back to you what you've told me, and tell me if any of this is wrong, or you think there's something I've missed that's important. So essentially for the last 6 months, you've been having episodes of difficulty in breathing, which is associated with a pounding in your chest. You breathe very fast. You feel anxious when these come on. And you sit down and they essentially go away slowly.
Yeah.
But they come on very suddenly and then abate very gradually. And you mentioned you have some tingling around your mouth and your fingers when they come on as well. And I didn't ask you, but are they getting more frequent, do you think, in onset? Or?
I don't think it's becoming more frequent, but it's happening quite a lot.
Okay. But you've never blacked out, apart from this episode 3 years ago, rather, when you were playing squash.
Yeah, it was easy.
And you don't have any pain or any other sensations associated with it. Okay. And no headaches or other dizzy spells that aren't associated with these episodes?
No.
Right. Is there anything else you think is important or we haven't covered?
I don't think so.
Okay, great. Well, thanks very much.
Thanks.
The history-taking scenarios in PACES quite commonly include scenarios in which the candidate's been tested on their ability to differentiate between a primary psychiatric problem or an organic one, and this is a common diagnostic dilemma. This is testing not only your knowledge of basic or commonly occurring psychiatric syndromes, but it's making sure you have a means of assessing the likelihood of a psychiatric versus an organic disorder. In particular, they're looking for your knowledge of symptoms which have a high specificity and sensitivity for a psychiatric problem, and those that have a high sensitivity and specificity for an organic one. In this case, we're presented with a 33-year-old plumber who has a very compelling history for generalised anxiety disorder with panic attacks, possibly as part of a post-traumatic stress disorder. He has episodes that are consistently triggered in dark places where he feels slightly hemmed in. He has a past history of a traumatic event, and he has episodes of intense anxiety and feelings of impending doom associated with his heart pounding and difficulty in breathing, and it seems to abate gradually. And the key part of the history is the perioral tingling and the paresthesia in his fingertips as well, which are typical of someone who is hyperventilating. That would have a high sensitivity and specificity for that diagnosis. On the other hand, this is a gentleman who has collapsed while exerting himself playing squash 3 years ago, and this hasn't been investigated any further. He clearly is tachycardic during these events and can feel his heart racing away, and he has a family history of sudden death at a young age. We don't know why his father died, but it may well have been due to a cardiac problem. He's also a drinker, which is a risk factor for cardiac arrhythmias. So the candidate in this case would be expected to entertain both diagnoses and not dismiss one in favour of the other, and make sure in their problem list they have a clear investigative plan for determining what the underlying cause is. And this would, in this case, I imagine, involve in the first instance cardiological investigations to exclude an arrhythmia. Candidates would also be expected to recognise that if this is post-traumatic stress disorder, that's a treatable condition, and it would require referral on to a clinical psychologist or psychiatrist.